When we think about our romantic encounters with others, we often envision uninterrupted passion that lasts for hours. This is probably thanks to a combination of montaged love scenes in movies and the 18+ content that we have consumed in our lifetimes. In actuality, there can be awkward moments and hiccups that occur that can be challenging if we don't know that it's common and how to handle it. With that in mind, today we're going to talk about erectile dysfunction. So whether you're a penis carrier yourself or simply like to play with them, this episode is for you. Welcome back to Savvy Psychologist. I'm your host, Dr. Monica Johnson. Every week on this show, I'll help you face life's challenges with evidence-based approaches, a sympathetic ear, and zero judgment. Erectile dysfunction, or ED, is a condition characterized by the inability to achieve or maintain an erection. This condition can have profound effects on a man's self-esteem, relationships, and overall quality of life. Erectile dysfunction is a common condition affecting many men worldwide. Studies estimate that about 52% of men experience some form of ED at some point in their lives. The prevalence of ED increases with age, with around 40% of men affected by the age of 40 and nearly 70% of men affected by the age of 70. However, ED is not just an issue for older men. Younger men can also experience it, with studies suggesting that approximately 26% of men under the age of 40 have ED. The condition can be influenced by various factors, including physical health, psychological state, and lifestyle choices, making it a widespread and multifaceted health condition. While ED is often associated with physical causes such as cardiovascular disease, diabetes, and hormonal imbalances, psychological factors also play a significant role in the development and persistence of this condition. So, understanding the psychological causes is crucial for effective diagnosis and treatment. So now we're going to jump into some of the psychological causes of erectile dysfunction. The first one that I'm going to talk about is anxiety. So anxiety, particularly performance anxiety, is a common psychological cause of ED. Men may feel intense pressure to perform well sexually, leading to stress and nervousness that can inhibit the physiological processes necessary for an erection. The fear of not being able to achieve or maintain an erection can create a vicious cycle where the anxiety itself prevents the desired sexual function, leading to further anxiety. Depression is another significant factor contributing to ED. Depression can diminish sexual desire, reduce overall energy levels, and impact the neurotransmitters involved in sexual arousal. Antidepressant medication, particularly selective serotonin reuptake inhibitors or SSRIs, can also contribute to ED as a side effect. The relationship between depression and ED is bidirectional. ED can lead to feelings of depression, and depression can cause or exacerbate ED. The next psychological factor is stress. So stress from various sources, including work, financial issues, and personal relationships, can affect sexual performance. Chronic stress leads to elevated levels of cortisol, a hormone that can reduce testosterone levels and impair erectile function. Additionally, the mental preoccupation with stressful thoughts can distract from sexual arousal and performance. Another factor to consider is relationship issues. So, interpersonal relationships play a crucial role in sexual health. Conflicts, lack of communication, and unresolved issues with a partner can lead to ED. Relationship problems can decrease sexual desire and intimacy, making it difficult to achieve an erection. Conversely, ED can also strain relationships, creating a feedback loop that exacerbates both the sexual dysfunction and the relational discord. Men with low self-esteem or negative body image may experience ED due to feelings of inadequacy or embarrassment about their physical appearance. These feelings can create a mental barrier to sexual arousal and performance. The pressure to meet perceived standards of attractiveness and masculinity can further aggravate the situation. Individuals who have experienced sexual abuse or trauma may develop ED as a result of the psychological scars left by these experiences. The trauma can lead to a range of emotional issues, including anxiety, depression, and PTSD, all of which impact sexual function. Negative associations with sex and intimacy can make it difficult to relax and become aroused during sexual activity. Addressing the psychological causes of erectile dysfunction requires a comprehensive approach. That may involve therapy, medication, and lifestyle changes. I'm going to highlight a few effective treatment strategies. The first one is psychotherapy. Cognitive behavioral therapy, or CBT, is particularly effective in treating ED related to psychological causes. CBT helps individuals identify and change negative thought patterns and behaviors that contribute to sexual dysfunction. Therapy can also address underlying issues such as anxiety, depression, and relationship problems. In the same vein, for men whose ED is related to relationship issues, couples therapy can be beneficial. This form of therapy focuses on improving communication, resolving conflicts, and enhancing intimacy between partners. A supportive and understanding partner can play a crucial role in overcoming ED. The next strategy is stress management. So techniques such as mindfulness, meditation, and relaxation exercises can help reduce anxiety and stress. Learning to manage stress effectively can improve overall mental health and reduce the impact of stress on sexual functioning. Keep in mind that in some cases, medication may be prescribed to address underlying psychological conditions. So antidepressants, anti-anxiety medications, or other psychotropic drugs can help manage symptoms of depression and anxiety. However, it's important to discuss potential side effects, such as ED, with a healthcare provider. And lastly, I want to talk about lifestyle changes. Adopting a healthy lifestyle can improve both mental and physical health, thereby reducing the risk of ED. Regular exercise, a balanced diet, adequate sleep, and avoiding substances such as tobacco and excessive alcohol can all contribute to better erectile function. Erectile dysfunction is a multifaceted condition that can be influenced by a range of psychological factors. Anxiety, depression, stress, relationship issues, low self-esteem, and past sexual trauma can all contribute to the development and persistence of ED. Understanding the psychological basis of ED is essential for effective treatment and management. By addressing these psychological causes through therapy, medication, stress management, and lifestyle changes, men can improve their sexual health and overall quality of life. Were you surprised by how common ED actually is? Please let me know. You can contact me via Instagram at KindMindPsych or via my email at psychologist@quickanddirtytips.com. The Savvy Psychologist is a Quick and Dirty Tips podcast. It's audio engineered by Steve Rickyberg, with script editing by Brandon Getchis. Our podcast and advertising operations specialist is Morgan Christensen. Our digital operations specialist is Holly Hutchings. And our marketing and publicity associate is Davina Tomlin. Follow Savvy Psychologist on Apple Podcasts, Spotify, or wherever you listen to podcasts. That's all for this episode of Savvy Psychologist. Thanks for listening, and I'll see you next week.